we have Myra Watnick.
Can you hear me?
Yes, I can. Go ahead.
Okay. Good afternoon, Senator Kushner, Senator Anwar, Representative Linehan, Senator Wang, and distinguished members of the Public Health Committee and Committee on Children. Thank you for the opportunity to provide testimony today on HB 5001, an act concerning children's mental health, and SB 2, an act expanding preschool and mental and behavioral services for children. My name is Myra Watnick, and I am the Director of Rehabilitation Associates of Connecticut, one of the birth to 3 providers, serving more than 1,000 families each month. We actually have 2 birth to 3 programs. One specializes in working with children on the autism spectrum. The other works with children with any type of delay that qualifies them to receive services through the Office of Early Childhood's Birth to 3 program. In addition to speech pathologists, occupational therapists, physical therapists, and teachers, we have licensed behavior analysts who specialize in working with children on the spectrum and any child who has behavioral issues. We provide consultations, behavior plans, and a coaching style of interaction so that families can successfully model positive behaviors. We have licensed clinical social workers and a school psychologist who has specialized in working with the birth to 3 population. All of these individuals have multiple degrees and are experienced and highly paid. They are overworked and barely able to see all of the families who require their services at this time. The rest of the staff have asked to meet with the social workers as well regarding their own mental health during this stressful time. We are providing reflective supervision to our staff to support their needs, and we are not currently reimbursed for this staff support. Working remotely and working in the home and daycares has caused many problems for staff as they need to go back home or go to the office when parents are canceling last minute. And the children require many more behavioral services in real time. Meeting the demand for these behavioral interventions require additional staff that is so hard to find and keep in the system long-term. COVID-19 has made everything more difficult. Delivery of services in a timely fashion and meeting the needs of families in crisis. The pandemic has been 2 years of continuous trauma for children and families, and Connecticut must act now to meet the behavioral health needs of children for years to come. I appreciate the legislature's intent to do so. The mental health of families and staff alike and children's behavioral challenges is causing a heightened level of crisis management. Birth to 3 behavioral health service delivery needs to be expanded as we add home and community settings as additional test sites. Birth to 3 does not have wait lists per se, but it takes longer from the day of intake to the start of services. We are looking for your support to increase interim gap payments to programs on an emergency basis. In addition, loan forgiveness for staff would go far for attracting much needed staff. Thank you for the opportunity to testify and for all the considerations. There are many programs that are considering leaving this year. We need to keep all of these experienced programs operational so there is adequate quality service delivery for the children and families in Connecticut. Thank you for listening.
Thank you.